For the last nearly 2.5 months, the country has been on a lockdown due to the COVID-19 pandemic. As this lockdown is eased, records show that there is a rise in numbers of mental illness.
I looked at the numbers that we had in February. That was before February 2020. That was before the lockdown. And the numbers we had for a month between April and May, and the numbers have doubled.
Dr. Nakku says there is a significant rise in cases of stress and depression.
A lot of people going into anxiety problems, a lot of people having features of stress. There are some people who have developed depression. We have even seen people who have become suicidal.
What about the spike in cases of domestic violence during the lockdown?
Because people are generally unhappy, stressed out, and feeling caged in. So they end up bringing it out on others. Usually those are people around them who are close to them. And most of the time, and because people are in lockdown, it is the family members.
Dr. Nakku explains that the lockdown rendered many people idle.
We have had plenty of people drinking quite heavily, more heavily than usual. And this is because, first of all, they have nothing to do. They are sitting around, idle, bored, because people are not sure of tomorrow. They are not sure of school fees. They are not sure of what their children will eat. That uncertainty causes people sleepless nights. And when people don't sleep, anxiety builds up.
The doctor says Butabika Hospital has the capacity to deal with the new numbers.
We have space to treat people who need especially admission. Fortunately, these common mental disorders don't all the time lead to admission.
Dr. Nakku has some advice on how to avoid these illnesses.
Try and reconnect. Fortunately, the lockdown is easing, so it is easier to reconnect now, but we must reconnect safely. Don't stay in isolation, even during the lockdown. Reconnect.
For a long time, mental illness has been considered a silent pandemic in Africa and even here in Uganda. However, with the unprecedented times brought on by the COVID-19 pandemic, health experts say that it is now time for this issue to be brought to the fore and given top priority for the wellness of Uganda's citizens. Joyce Nakato, NTV Tonight.